Good morning. First, I want to thank everybody for coming today. I'd like to begin by acknowledging that we are here gathered on the traditional unceded territory of the Algonquin Anishinaabe people. I'm also joined here today with my colleague MP Peter Julian, the NDP health critic and House leader, and the co-chairs of the Canadian Alliance on Mental Illness and Mental Health, Anthony Esposi and Florence Budden. I'd like to recognize that this is Mental Illness Awareness Week, and today is World Mental Health Day. Right now, there is a spotlight on mental health, and with that, a chance to build momentum for policy changes that will make a difference in people's lives. And that's why earlier this morning, I introduced a bill, the Mental Health and Substance Use Parity Act, proposing to amend the Canada Health Act to bring community-based mental health, addictions, and substance use services into our public healthcare system. While we've made strides dispelling stigma around mental health, we haven't ensured that supports are available when people come forward and ask for help. If we truly believe mental health is health, that must be reflected in the framework for our universal public healthcare system and ensure that we have timely, inclusive, and accessible mental health care and substance use care here in Canada. The chronic underfunding of mental health and exclusion of community-based supports from the Canada Health Act have left too many Canadians going without the care they need because of out-of-pocket costs or long wait lists. And this can be a matter of life or death for those struggling with substance use disorders or other mental illnesses. The government promised to make mental health a full and equal partner of Canada's public healthcare system, but they failed to deliver meaningful progress at a time Canadians need support more than ever. Canada is experiencing a mental health crisis, and the rising cost of living has poured fuel on the fire. It's added to the stress Canadians are dealing with daily while putting supports like counseling or substance use disorder treatments further out of reach financially. As Canada faces compounding mental health, toxic drug, and homelessness crises, we can no longer accept a system where mental health care is treated as a luxury good. Untreated mental illness has enormous costs for Canadians, their families, and our communities. No family is left untouched by this crisis. And polling published by the Canadian Mental Health Association last year found that 87% of Canadians want universal mental health care. It's time to deliver transformative change that will ensure mental health is treated equally to physical health and allow people to get the care they need with their health card, not their credit card. And that's the change this bill envisions, and that's the change I will keep fighting for. I want to thank everybody who's tuning in today, and I'll turn the mic over to my good colleague, MP Peter Julian.
Merci beaucoup, Gord. Et ça me fait plaisir de me lever pour appuyer le projet de loi de Gord Johns, surtout dans cette journée qui est la journée mondiale pour la santé mentale. Et là, on voit qu'il y a une crise de santé mentale à travers le pays. On a vu depuis COVID surtout qu'un adulte sur 5 est assujetti aux défis qui sont liés à la santé mentale. Ça, c'est une épidémie. Et Gord Johns et son projet de loi et l'NPD veulent confronter ce défi-là. On voit que de plus en plus les gens en arrachent. Et au niveau de payer pour leur service de santé mentale, c'est souvent un problème. Et c'est pour cette raison-là que Gord Johns propose et l'NPD propose qu'on mette toutes les questions de santé mentale et l'usage des substances dans la loi canadienne sur la santé. Ça veut dire une accessibilité pour ces services-là, que ces services-là soient rendus universels à travers le pays, que ce soit là quand les gens en ont besoin. Et là, on a vu des sondages qui indiquent que 87% des Canadiens veulent justement voir un accès aux santé mentale et services de santé mentale qui est universel. C'est pour cette raison-là que c'est extrêmement important que ce projet de loi soit adopté, qu'on a des services de santé mentale, qu'on a des services pour l'usage des substances qui sont offerts de façon universelle et accessible à travers la loi canadienne de la santé. Alors, moi, je rejoins ma voix et l'NPD est absolument d'accord avec le projet de loi de Gord Johns. On en a cruellement besoin. Il faut que ce soit adopté et on va continuer à pousser pour que la santé mentale et des services liés à l'usage des substances soient accessibles à toutes les Canadiennes et Canadiens.
Merci, Peter. Now it's a huge pleasure and honor to take the time to introduce some good friends of ours from the Canadian Alliance on Mental Health and Mental Illness and Mental Health, Anthony Esposi and Florence Budden.
Good morning. My name is Anthony Esposi. I'm the co-chair of the Canadian Alliance on Mental Illness and Mental Health, and I'm here today with my fellow co-chair, Florence Budden. CAMI is an alliance of 18 national mental health and substance use health organizations comprised of people with lived or living experience, their families, caregivers, and mental health care providers. CAMI's mandate is to ensure that mental health is firmly placed on the national agenda so that the people of Canada in need of mental health support and their families receive timely access to equitable and inclusive mental health care programs, services, and supports. As a mental and substance use health coalition, CAMI is thankful to MP Johns for tabling this important bill. It is imperative that all parties come together to resolve the systemic issues we face to improve and expand access to publicly funded mental health and substance use health services. As the leading national mental health alliance in Canada, CAMI has been advocating for parity in funding between mental health, substance use health, and physical health care. In June 2021, CAMI released From Out of the Shadows and Into the Light, Achieving Parity in Access to Care Among Mental Health, Substance Use, and Physical Health, a report detailing the need for parity in access to care and what steps the federal government can take to achieve this. Let's be clear. There is no health without mental health and substance use health. Right now, people who are looking to access mental health and substance use health support are faced with long wait times, inadequate care, and a lack of services. If you were to seek treatment for a physical health issue, you would not face those same barriers to care. This is why we need the federal government to take legislative action to make sure that Canadians that need support for their mental health or substance use health have the same access to care as other health needs. For too long, mental health and substance use health have been an orphan of Medicare, and this must change. The only way that we see meaningful change in the healthcare system is to level the playing field between physical health and equitable and inclusive mental health and substance use health care. In January 2023, CAMI released a mental health and substance use health report card which polled Canadians across the country about whether their mental and substance use health needs were being met. Tragically, both federal and provincial governments received a resounding F from Canadians when it comes to providing mental health and substance use health care services. These failing grades clearly need to be improved upon and can be with leadership from the federal government. CAMI will be delivering a third annual report in the coming months for 2024, and sadly we expect it will yield similar results, as we have not seen substantive action by governments to expand public funding for mental health and substance use health care. CAMI's report shows that Canadians are not getting the care they need when they need it, and this must change. It is clear that the federal government must significantly increase investments in providing better access to mental health and substance use health services in the provinces and territories across Canada. Florence?
Good morning. Now, more than ever, we need improved access to accessible and inclusive mental health care programs, services, and supports. I will repeat this as it is an imperative to be clear. There can be no health without mental health. And there can be no substance use health without mental health. And so we should treat it equally. It's deeply concerning to know that close to half of all survey respondents across Canada gave the provinces a failing grade of F. The report shows overwhelmingly that Canadians do not have timely access to mental health care and or substance use health care they need and deserve. Those who felt their needs were not met or were only partially met cited wait lists, a systemic issue, as the reason. Not surprisingly, an overwhelming majority felt that governments need to increase the availability of healthcare providers. We're highlighting today ongoing issues within our healthcare systems in Canada that are within the control and responsibility of government. It is clear that the federal government must significantly increase investments in providing better access to mental health and substance use health services in the province and territories across Canada.
Well, I want to thank Florence and Anthony for the important work that they're doing, the 19 organizations that participate with CAMI, all of the workers and the people on the front line in those organizations for the life-saving work that they do. And we owe it to them. The Government of Canada owes it to them to provide the necessary supports so that they can continue doing the life-saving they work and make sure that all Canadians get accessible, timely, and inclusive support that they require, life-saving support. I'm open to taking questions now.
All right, we'll take the question from Zoom. I see I have one reporter online. Mark, if you have any questions, please use the raise hand function, and the floor is yours.
Hello, I have a question for Mr. Julian. The PBO just updated its report on carbon pricing. There's not much different than its previous reports, showing that when you consider the wider economic impact, carbon pricing, it has a negative economic impact. I just want to get your reaction to that, if you have one.
I haven't read the report, so I can't comment on it, but I'm sure we'll be able to follow up later today.
Okay, I'll try you one more time just on one other thing that the report mentioned, which is that the industrial carbon price costs less to Canada's economy and contributes vastly more to our emissions reductions. I know you guys have always said that you want that to be stronger. Does that, vindicate your position in any way?
Well, again, I haven't read the report, so unfortunately I can't comment on it, but we will certainly be providing you with a response as soon as possible.
Okay, I'll ask about the topic at hand then. I'm just curious if this policy is something that you guys are going to try to negotiate with the Liberal government to try to implement as a condition of, keeping this government intact.
Well, I mean, this was a commitment that the government made in 2021. So, we're expecting that the government would deliver on this promise, that there would be equal care for mental and physical health, and there would be parity, and they haven't done that. And we hear from all parties in the House. We forced an emergency debate in the House of Commons on mental health last year, a take-note debate as well. And again, we heard from all political stripes that they would support parity. So here it is. We put forward legislation. It's an opportunity for all parties to come together, get out of the sandbox that's taking place right now in Parliament, and get to work for Canadians. This is an emergency right now, and this is an opportunity to save lives. And we're hoping that everybody will get behind this legislation, especially today on World Mental Health Day. So we're hoping that we're going to hear a response from all political parties that they support this legislation. We can move forward.
Hear, hear.
All right, thank you.
This brings an end to the press conference. Mais à la fin de la conférence de presse. Merci beaucoup. Thank you.
Merci.
Thank you.
you.